Hello, everybody. Okay, we've got a few people here now, so we'll probably kick off. Today, I'm going to be focusing on elements of task 2. Okay. Task 2 is a written task. No, not task. Yeah, task 2. So task 2 is a written task where we're going to be discussing the factors affecting health across the nation and then discussing potential benefits. Okay, so we're gonna discuss that today. Let me just get up my slides. Okay, so we're going to talk a bit about some of the factors affecting health. So good or bad health is not just a result of your personal behaviours, and it's not just a result of your genetic makeup, and it's not just a result of how good your doctor is, your personal doctor. Quite a large part of the difference in health outcomes we've identified over the years is down to a much wider area of issues. It's down to the sort of social issues, the economic issues and the environmental issues that really surround you and affect your life. And when we put all of these things together, we actually call them the wider determinants of health. Okay. So here's a graphic for you that might be useful to think about the wider determinants of health. In the orange circle, you've got the stuff that's very much related to you, your age, your sex, you know, literally how fit you are. It might be your genetic makeup. You might be robust, you might be weak, you might have been born early, so some of your organs might be a little bit weaker if you're a premature baby. Those sorts of things are all about what you start off with, really. As you can see, the next circle focuses on you still as an individual, and it focuses on your lifestyle and your behavior, which really relates to the sort of choices that you make within your lives. You know, do you choose to smoke? Do you choose to drink? Do you choose to do dangerous sports? Do you choose to stay at home watching TV all night? You know, those sorts of lifestyle choices. And of course, each one of those choices can have an effect on your health as well. The next band, social and community networks, is what's out there, really. This is about your friendships, the places you go, the people you meet, the activities that you do, what sort of support there is in community. Are there exercise groups you can go to? Are there food banks if people are short of food? How does the community help the homeless? These sorts of things, because that, you know, if that's you. Are there social clubs that you can join if you're lonely, or you know, are there things that you can do? Are there ways where you can harness your artistic nature? Are there music places you can go to dance if you're a dancer? Those sorts of things, really. So it's all about what's in the community around you and how does that support your healthy lifestyle. So these are things to think about too. In the big green one, these are sort of very important issues. These are the living and working conditions that you're in. So these are not really just individual now. We're talking about, you know, all the people in your town, all the people in your area where you live. What are the conditions like around there? So this is not just you, but other people will be affected like that. So we're going a bit wider now. We're going to your family, your wider family, and your neighbours and the people around you. And as you can see, the green curve is quite large. To the left, it looks at what's the work environment. So those of you who are in work, what's the environment like? Is it a healthy environment? Is it an unsafe environment? Are there health and safety issues? Is it heated well, lit well? You know, are you at risk of illness from maybe you know, because you work very closely with other people? Is it office based? Are you working in a factory? Are there other risks there? Do you do a lot of heavy lifting? So does that have an effect on your health? All these different things about the work environment. Do you work very long hours? Do you work short hours, you know? And then going around the curve, you're looking at education. How well educated are people? Does everybody attend school? Do people attend school as long as they wish? Are there restrictions? Are you going to school? If you're a girl, are you not allowed to go to school because of the way you live? You know, so those sorts of things. So are people held back from education, or is it too far away? And then it moves around the curve to agriculture. You know, does your country or your area get enough food? Is there enough food in the shops? Do you produce enough food? You know, is it the right variety of food for people's needs? So does that make the country solvent, really? Because there's always income from food too. Going to the right side of the curve, we look at some other sort of bigger picture ideas. Unemployment. The left side looks at, you know, what do you do at work? The right side looks at, are you unemployed? Is it easy to get work? Have you been unemployed for a long time? What sort of financial support do you have for unemployed? Does it help you? You know, are you able to eat? Are you able to pay your bills? Do you have enough benefit? Does the government give you enough help? Are there charities that can help? And do you use them? Or are you at home owing money, not being able to heat your home, not being able to get enough food? Are you at risk of being homeless? Because if you're at risk of being homeless, that really affects the chances of your health sort of going down very much. Water and sanitation. Do you have clean water and functioning sanitation? Is this something that you've just got? Is it something that you've always had? Are there issues about it? Does it happen? You know, do you have problems now and then? Or is everything fine? Do you live in the city? Do you live in the country? Are there differences if you travel about? And then healthcare services. Again, does it depend where you live? Do you have the service on your doorstep or around the corner? Can you walk to a GP? Or do you have to walk miles to go to a clinic and then queue up for a long time? All these sorts of things affect how good your health is, because people who have to walk a long time and queue up for hours for clinics or go a long time to a hospital will probably go less often than people who can just pick up a phone and make an appointment and you know, walk a mile or so, or drive around the corner if they want, you know. So it does actually affect how people's health suffers. And the final thing in the green bracket is housing. What's the quality of your housing? Do you live in an overcrowded situation? Are there too many people in one room? Or do you have a house just for your family? Do you have a house just for yourself? Do you live in a crowded neighborhood? Or is your house good quality? Is it well maintained by either you or the people who own it? Is it clean? Is it fresh? Is it damp? You know, are there lots of maintenance issues that could affect your health? Lots of people who live in council accommodation may not have the money to maintain it very well, and often houses, you know, suffer from dampness, mold, mildew, which really affects people's chests, especially if they're young and vulnerable or elderly. And again, can you heat it well enough? Is it insulated properly? So there's lots of things about your housing can affect your health. And in the big blue curve around the outside, we're actually sort of moving out just from your local environment to the countrywide environment, really. So what are the environmental conditions for the country as a whole? Do you suffer from monsoons and floods? Is that a real problem? Because that will affect people's health, put you at risk as well. Are there sort of major diseases? Well, I mean, we've all had COVID sweeping through us, and that was, for all of us, that was a countrywide issue that really was detrimental to people's health. So what sort of cultural issues are there that may be affecting people's health, maybe stopping women accessing different services, because there's a cultural issue about that? And also general socio-economic, you know, do you live in a wealthy country? Do you live in a poor country? What's changing, really? Is it changing for the better? Is it changing for the worse? I mean, all the modern countries at the moment are being hit by huge cost of living increases, and huge issues around fuel as well, getting access to petrol, because there's problems going on in Europe. That's certainly a very big issue for me in this country. Our petrol prices have suddenly gone through the roof, really, really escalated. And we did have some access issues at Christmas time. That seems to have gone, but it's more about people struggling to actually afford to buy fuel at the moment. And also there's a massive economic issue again all over Europe. The war in Ukraine and Russia is causing a problem, because Ukraine is one of the, well, for Europe particularly, well, for the world, one of the biggest exporters of wheat and sunflower oil as well for cooking with. So these things are starting to get difficult to obtain across Europe, in the UK included. Prices are going up. And while the war goes on, that's not really going to improve, because the farmers are too busy fighting, quite rightly, you know, to put their crops in. So even if the war finishes soon, maybe the crops might not be any good for this year. We just don't know. So it's a real issue. The Russians control quite a lot of oil and gas that goes into other countries in Europe, and that's a big issue too, because countries are trying to remove their reliance on Russia, because Russia's considered a renegade nation at the moment. There are lots of trade deals being made, but at the moment, most of the people in Europe are suffering from very, very high prices, the difficulty with accessing things. So the socio-economic climate of the whole country will affect an individual's health, or could affect an individual's health. Okay. So we're gonna look at some of these aspects in a bit more detail. So let's think about the environment. Most of my PowerPoint focuses around England, because I gathered a lot of the information from Public Health England, which is our public health provider that creates a lot of data. So my data is very English orientated, not even UK, but because it's for this country, not particularly Wales, Ireland or Scotland. But quite a lot of the things that I'm saying, even if the numbers aren't exactly the same, the general statistic trends will be the same for most places. You know, when I talk about the city, it'll be the same for most sort of modern cities, like for yourself, and sort of a lot of issues that I'll talk about will be very similar to Kuala Lumpur and other big cities. But what you could do, if you wish, when you do answer this question, you can either just use my information and talk about, you know, what's happening in England and in the UK, or you can use your own information and look at what's happening in Malaysia, Indonesia, wherever you're based, if you wish to. I don't think the trends will be that different. It's just the numbers might be different. So just have a think. I'm happy for you to do it any way you wish, really. If you don't want to do it for Malaysia and Indonesia, you can actually do it to your home country as well. I know a lot of you are not living in your home countries at the moment. And if you would like to, you can do it from your home country if you think it'd be more interesting. I really don't mind. As long as whatever country you pick when you're talking about it, you sort of stick with it a bit. Or you can do some comparison. You don't have that many words to answer this question, so I would stick with one if you want. For those of you from Afghanistan, it might be quite difficult if you wanted to do Afghanistan, because I think things are in such turmoil there. You may not even get the data. And, you know, it's difficult because some, you know, I don't know if the people in charge are actually focused on this sort of information. So it might be a struggle, but you certainly will get it if you wanted to do Malaysia, Indonesia, or wherever you're residing at the moment. Okay, so let's think about the environment. So as I said, I'll be reflecting on England, and you can do what you wish. So most people spend a large amount of time in human-made environments. So particularly if you live in the town or the city, you know, most people are in houses, in offices, in shops, on the road. And these are all things that have been created by humans. There are some of us who live out in the country in a more rural environment, but even so, your villages and that are still, and the roads between the farms are still human-made. So it's a sort of human-made or a human-modified environment. So things like neighbourhood design and the sort of housing that's built, the sort of housing that people live in, are really important, and they sort of part of the determinants of health, as I've said. Air quality is a big issue. It's a sort of central feature of the environment now, particularly in urban cities, particularly in the bigger cities, all around the world, really. I mean, in some cities, it's much, much worse than others, but it is one of the issues of cities. The rural environment probably doesn't have so many issues with air quality, but overall, in a country across the board, because there's much larger population in the cities and big towns, when it comes to numbers, a large amount of the population are actually affected by air quality and air pollution. Okay. Some of the strongest evidence is effects of fine particulate matter and exposure to fine particulate matter, which is known as PM 2.5. And we know, we've got data to show that it increases the risk of mortality, increases the risk of death or serious illness, particularly from heart and lung conditions. Cars, traffic. The biggest pollution in most cities, yes, there can be toxic gases and pollution from factories, absolutely, but actually a lot of those have cleaned up their acts over the last sort of 30 years. But the one thing that you know was steadily getting worse is pollution from traffic, cars, vans, lorries, you know, day-to-day traffic. And that's why it's particularly bad in big cities, because generally in big cities you have more traffic. Okay. And there's also an issue about disadvantaged communities. Like you find that even in the big cities, there are differences of areas. The areas where the richer people live, you get less traffic. Poorer people tend to live in the more polluted spots because they maybe live in cheaper housing near the very busy roads, small, cheaper, more crowded housing near the busy roads. So and not only do they have housing issues, but they have exposure to this. And we've now done quite a lot of research in this country to prove the connection between busy roads and the level of pollution, particularly in children. They've been doing a lot of work with some schools in London, which are very close to extremely busy roads. And the level of asthma and unusual lung conditions are just very, very high. And they're all related to sort of lead and fuel pollution. Obviously, lead has been reduced. When cars were running on, lead in petrol, it was even worse. So a lot of work has been done by the car companies, hasn't it? With catalytic converters and that, to take the lead out of petrol. Most petrol's lead free now. But there is still enough sort of dirty chemicals, particularly in diesel and petrol. So diesel, all the vans, lorries, well, a lot of cars as well run on diesel, and diesel is still fairly dirty and it still causes this sort of pollution. So it's a big issue. So the environment is being poisoned by the traffic, really. And not just the environment, but that means the people who live in it, walk about, breathe. Okay, so when children are out playing in the street, the chances of being polluted are high if they live near a busy road. So just to consolidate that, really, here's a little map of the UK. Well, the UK without Ireland and Scotland. So it's just England, really. And it shows you see where it's more purple. These are the areas where pollution is of a very high concentration. And if you look at the sort of deep purple bit down here in the middle, down at the bottom, that's London, really, and Greater London. And that is where the densest population in the country is. And that's where the most traffic is. So, where there's a lot of people, there's a lot of cars, there's a lot of vans. So we're also quite influenced by weather patterns as well, which is why the east of the country is more purpley than, say, the west of the country, because we've got Europe all on the side here, and the weather patterns come from Scandinavia and Europe, and they hit the east of the country first. So if there's any sort of pollution in the air, because we are actually quite close to Europe, it's not that far, any pollution in the air, it will come and hit the east of the country first. That was a big issue when they had that volcano in Iceland, because even though Iceland's quite a long way away, the weather patterns were bringing it down to the east of the country, so we were actually getting some of it, which is amazing, really. So you can see you've got two very purpley areas. So the bottom one is London. The one up in the middle of the country is, funnily enough, known as the Midlands. And the big city there is Birmingham. But all around there, where you can see the pollution is very high, this is where the majority of our industry is. A lot of industry in the UK is here in the Midlands. And you can see, because of that, there's a lot of trucks going to and fro. And this is also where all our car building businesses are. Strangely, they all happen to be in the Midlands. And also lots of other engineering factories, things like that. So you can see the difference in the pollution there. And then higher up, top part of England, which is the Lake District and, the fells, or beautiful rural walking country, not much going on up there at all. The purple bits right down at the edge on the coast, they are the ports. our big ports. So you've got Southampton and Portsmouth down at the bottom. Big ports where all the big ships come in, you know, bringing in everything that we need. And right in the corner of London as well, there's a big port there at Tilbury that brings stuff into London. So those are the three biggest ports. And then there's a big port right up here. So that little extra purple bit is Hull, I think. I'm not very good on geography at the top of England. If you want to know where I live just here above the Isle of Wight. I live in Dorset. And fortunately, we're not too bad here because it's quite rural, it's farming country. And the further out west you go, the less polluted it gets. But these ports here are extremely busy. Not only are they big container ships, but also this port here is where all the cruise liners come. We have thousands of cruise liners come every day, thousands of people on them. So it's a pretty busy place, really. Okay. So that just shows you, and you could probably find something like this for your own country. Like I said, if you're living in Malaysia at the moment, you can certainly find something like this for Malaysia. And you probably wouldn't be surprised when you saw the areas of pollution. You'd probably be able to guess where they were, really. Okay, one of the other issues we need to think about is housing. Okay, there are a few links here if you want to look at a little bit more detail. But there's been a lot of evidence of, in the recent last 10 years or so, that access to green space also has a beneficial effect on people's physical and mental well-being. And so one of the things they've been trying to do is, like in modern town planning, there was an issue about making sure people had enough sort of space. And so in the years 2011 to 2012, it actually increased from 14% to 17%. But really after that, it's been fairly unchanged. And when we build social housing, tend to be larger blocks of flats, they don't tend to get a lot of green space built for them. Maybe just a few trees out the front or something like that. When, you know, if you're a bit wealthier and you're buying a house, you tend to have a little bit of garden space yourself, which is just for you and your family. So it's fairly unequal, and it really reflects. So there are some people, especially in the poorer communities, they have very little direct access to green space, but they might have to maybe go walk to a park or something like that. Whereas richer people could maybe have a bit of green space out, you know, the back of their house, really. And these sorts of things really identify. Quality of housing as well, not just the green space around it, but some standards. We have the decent home standard, which all houses should be built to. But again, the more expensive houses, you know, for richer people, tend to be built, you may not be surprised, as are built to a higher spec than the public housing for poorer people, really. And if you have a look at our statistics, you know, we haven't done that well. 2016, 20% of the houses in England failed to meet what is known as a decent home standard. The decent home standard is not a standard, you know, for a flashy, lovely modern house. It's just what's good enough to protect your health and well-being, really. It's, you know, it's not anything glamorous. It's just what's acceptable. And we've got an awful lot of housing stock in this country that fails to meet the standard. And as you can see, it's actually gone down over the years. So 2016, it was 20%, but in 2006, 35% met it. And that's a real worry. I think you'll find that that's gone down again, probably over the last 10 years. Private rented sectors, people who can't afford to own their house, but rent their house, have the largest proportion of houses that don't meet the standard. That's probably not a surprise. 20% of the owner occupied, so where people own their own house, more meet the standard, because it's your own house, you do things to it, you know, you invest your money in it. Unfortunately, when it's rented, and it's rented from a private owner rather than a local council, it's up to them to do it. And some of them, you know, some of them are good, and some of them care about their residents, but some of them don't, and only do things when they get forced to. So housing is a big issue. And of course, if you live in unsanitary conditions, if your running water's good, like I said, if you've got damp on the walls, if your windows don't fit properly, and if the heating isn't good enough, then it will affect people's health. So these are things we need to think about. Homelessness is an issue in every country, especially in the urban areas, the city areas. There is homelessness. People who, for various reasons, lost their jobs, lost their families, lost their homes. So it can be a combination of individual issues, like maybe mental health problems, or social issues, you know, like I said, losing the job, losing the finance. And people who are homeless generally have a much, much poorer health situation. They don't have access to GPs because they don't have an address. If you don't have an address, you can't get a job. If you can't get a job, you can't pay for a doctor, various things like that. So, you know, they rely on charitable support, really, people going around the streets sort of giving help and advice to the homeless. So it's really not a surprise that they have, on average, poorer health than those of us who are housed or have our own jobs, have our own places and that. And they tend to die earlier because life on the streets is quite harsh. So there's some statistics really about people in temporary accommodation. And I put some little bits there for you about the homeless health check, so you can see how many people with homelessness have other physical, mental health problems. Okay, another issue to think about is education. How does education affect health, you say? Why would it affect health? Well, education is related to knowledge, really. And knowledge can often be linked with your health behaviours. So better educated people are less likely to suffer from long-term diseases because they know enough to actually, you know, go to the doctor and sort things out, or they work things out, or they look things up on the internet and come out with the answers. They're also less likely to suffer from mental health conditions. Obviously, they still can, you know, someone loses a loved one, you can end up with depression from your bereavement. But very often they sort of know what to do and have learned sort of how to resolve things. So it gives you the knowledge and the capabilities. It also, being quite well educated, gives you that added capability to manage things as well. In this country, educational qualifications help with your job. You know, without certain qualifications, there are jobs you can't do. The better your qualifications, the more jobs you can apply for. So it makes you more marketable. And of course, that affects your income. So if you're well educated, you probably, you know, you have a good chance, I'm not saying always, you have a good chance of having a better paid job. Better paid job, more income, gives you more chances to manage your health well, pay for your doctors, those sorts of things. So the material resources are important with health. Buy medicines when you want to, but just buy something from the chemist. If you don't have a lot of money, you might not make, you know, think, oh, that's a bit expensive. I'll wait and see if I get a bit better. So a little bit of statistics about education and health, just to sort of consolidate what I'm saying. There's some unequal attainment patterns due to relative deprivation. So when I say relative deprivation, what do I mean? Anybody know what I mean? Okay. If someone's deprived, it means that, you know, they go without something. Oh, okay. Someone's got an idea. Not sure. Okay. Deprivation usually means that you go without something. So it usually means you know, financial ability or lack of finance to buy things or to have what you need generally. And that could be food, housing, all sorts of things, paying the bills, these sort of things. So there's a sort of, they look at the deprivation scores on young people all the time to see how it affects their future. They do loads and loads of research on it. And as you can see here, it actually affects how they pass their exams as well. So people from a deprived background, which are the decile, so it's in sections of 10 when it says a decile. So the deprivation decile goes from 1 to 10. The most deprived 1, least deprived 10. And then if you see the line, that's the average of GCSEs. GCSEs are our, what we do at 16. They're our, used to be called O levels, but now they're GCSEs. So the average for England is 57.8 students attain 5 GCSEs at between grades A to C. So the middle to top grades. So that's how they work it. And if you have a look in the lower, the more deprived areas, those are the red bars, and the wealthier areas are the green bars. You can see that, you know, it really goes up. So with the red bars, nobody in the 1 to 5 levels of deprivation achieves the average grades, not good grades, but average grades. Okay. And then as you can see how it goes up from the bars 6 to 10, which are the wealthier. So 6 the lowest, 10 the least deprived, the wealthiest. You can see how their grades, you know, they nearly all go over the average. So they're getting more than 5 GCSEs at A to C. So they might be getting more A grades or more, you know, or they might be getting 6, 7, 8 GCSEs. So we've got a sort of clear thing here that your level of deprivation definitely affects your academic achievement. And this statistic has been the same. This one's 2015 to 2016, but quite honestly, it hasn't changed for years, really. So, you know, it's a fairly solid statistic. And I'm sure if you looked, if you could find a local statistic in Malaysia, it wouldn't be a lot different. Okay, so moving on to that. So we're talking about deprivation, and really deprivation is all about income or lack of it. Okay, so physical and mental health outcomes do tend to improve as income rises. So, you know, and people say, well, you know, or you get a lot of these sort of glib statements on Facebook saying, you know, you don't have to be rich to be happy. And I would say, but it helps, you know. No, you don't have to be rich to be happy. And I'm sure very rich people can also be very unhappy. But, you know, Kim Kardashian always looks fairly happy to me. The thing is, if you have money, you're always safe. There are things that won't happen to you. You probably won't lose your home. You probably will be able to pay your bills. You probably won't be worrying about where the next meal comes from. So, yeah, all right. I mean, you know, I know happiness is more than just having some money, but, you know, heck, it really does help. So income is related to life expectancy, and there's loads of statistics, and you can try and find some for me if you want. just to show that, you know, people with more money tend to live longer. Well, because they can afford to pay for the interventions and the medical treatments if they require it, that other people maybe can't. Okay, so we know very clearly that that's there. So, as I said, financial resources basically say you can invest in the goods and services. So, you know, I could, if I was really wealthy, I'd get a personal trainer to come in, because I'm so lazy and hopeless that I wouldn't do proper exercise unless someone was standing there talking to me. But I can't afford a personal trainer, and I hate going to the gym. But, you know, if I was really wealthy and had loads of time to spare, I might get a personal trainer to come in and just stand in the room with me and make me do it. And I'd probably end up looking much more glamorous, you know. But that will also improve your health. And you can purchase also the quality of food, which is really important to improve your health. So you get the right balance of proteins and vitamins, quality meats, those sorts of things, instead of eating sort of cheap junk food that are damaged and that. So. And the thing is, there's social and mental health as well. Again, if you don't have much of an income, it's quite hard to go out socially, to go out and enjoy yourself, spend money with your friends, go out dancing, go out for a nice meal. And all these things affect your emotional well-being as well. You know, go to the theatre, go to the cinema, maybe go for a day out to the zoo or something. All of these things can affect your self-worth and also your status as well, which all affects your well-being. So remember, we can't just take well-being away from health, physical health, but well-being is mental and social as well. Work. Okay, strong local economy provides specific quantities and quality of employment opportunities. So again, if you haven't got a job, it's hard for you to do some things. So work is good for mental and physical health. In addition to this, adequate, as I said, an adequate wage helps you buy the things that you need. But there's lots of social things about work as well. So it's not just about paying the bills, although that's really, really important. It's about all the sort of social interaction people get from doing a job well done, all the interaction people get from working with nice people they get on with, you know, all that sort of stimulation, sharing of knowledge, all those sorts of things, and allowing you to sort of feel like you're contributing to society, being a part of it. So all those sort of things are important. And for some people, not working might be the right option. But as long as it is an option and not something that people can't do when they really, really want to. And it's not just the adults who, if someone is unemployed and cannot get work, it doesn't just cause a problem for the adults, it causes a problem for their families as well. Very often, people who are suffering from unemployment, I mean, they often have secondary issues like depression, anxiety, as well as not enough finances to maybe buy things for their children that they would like to buy. And because of that, there is a clear knock-on effect that children of the unemployed, you know, they don't attain as well in their education. As I said, they would be one of those deprived statistics because maybe they can't afford to, you know, buy a laptop or something like that. They can't afford to buy the textbook, the extra textbook to help them through the exam, those sorts of things. Or somebody might be only just employed but having to work all hours, so they can't sit there and help sort of stimulate or support the children with homework and things like that. So it definitely has a knock-on effect. And if you can't sort of provide your children with some of the things that children want nowadays, that becomes very difficult as well. It affects the whole family, really. So work's really important for people's health. But actually, work can be quite dangerous to your health as well. There was nearly in 2016, 2017, per 100,000 workers, there was nearly 4,000 illnesses caused by work or made worse by work. So, going to work can actually be a dangerous thing to do sometimes. You have physical hazards. If you're a physical worker, there's always hazards putting your back out, hurting your muscles, sunburn is in my opinion. It doesn't happen in the UK very much, but there you go. Biological hazards, dealing with sort of things that aren't very nice, very safe. Ergonomic hazards, lifting things. Safety hazards, falling over, tripping over, slipping, electrocuting yourself on something that isn't properly looked after. So this has always been an issue. 80% of the illnesses delivered by work are stress, depression, and anxiety, just for the demands of work, and then that unfortunately gets higher as the world gets more complex. And as you move up in the steps of your job, when people get up to management level, it doesn't get easier. It gets harder. You get much more stress and anxiety with it. But those who maybe aren't in management levels work, or maybe in something more physical, musculoskeletal disorders like falling over, straining yourself, pulling a muscle, bumping your elbow, all these sorts of things happen. So work can be an unsafe place. And obviously there are huge health and safety issues around. And we have lots and lots of laws around how workplaces, offices, and factories are expected to function. So that still doesn't mean accidents don't happen there. Crime is an issue. It can affect physical and mental health. Violence against people is one of the biggest crime issues. But sometimes it's not just being, a victim of a crime, although that's pretty horrible if someone hurts you as well. But sometimes for some people, it's the fear of crime, fear of sort of, walking home in a certain area. You might have read a newspaper report that said somebody got robbed in the next street to you. That's quite worrying. So the fear of crime can cause stress and anxiety, which can affect someone's mental health as well. There is obviously the economic cost of crime. If your car gets broken into and gets stolen, yeah, you've got insurance, but it usually becomes more expensive for you. If your house gets broken into, yes, if you're insured well enough, you might get something back, but that's difficult and becomes a problem. But it's also still quite emotional and anxiety creating when you've been robbed. Unfortunately, the more deprived the area, the higher the rate of crime. That's certainly true in England. You can check that for me and see if it's the same in your home country. But very often it is. And often the criminals tend to live in deprived areas as well as their victims. So it's strange. We've always got this assumption that criminals tend to, go into sort of very rich areas and rob them, but that isn't necessarily true. Sometimes they rob the people in the middle, but they don't normally go to the very rich areas because normally it's too difficult, to be honest, the security wise. So they tend to rob their own people because they can break into their cars easier and things like that. So, but crime, as I said, if you're a victim of crime, it can be some physical health issues, but also mental health issues. Okay, impact of lifestyle. Well, I guess we all sort of know about this sort of stuff, really. How does your lifestyle affect your health? the sort of behavioural and social issues that negatively impact your health include smoking, alcohol, poor diet, lack of physical exercise, sexual behaviour, and problems resulting from drug taking. There's just some ideas. I'm sure there are more. These are probably the most common ones. So let's have a think about what the issues are. So if I show you some of the major ones, people like to tell me what might be the issues that come out of that then. So smoking, how does that affect your health? Anybody? And cardiovascular disease, because smoking, remember, drops out of the cigarette, as well as the tar. There is also a fatty substance, rather horrible, that burns as well and solidifies, and it gets into your bloodstream and clogs up your heart too. So that's lovely. Something to think about. Alcohol, anybody? How does that affect your health? Who's that there? Certainly does affect our liver. Also cancer. You can get cancer of the mouth from alcohol. Damaged kidney. Yeah, Foyaz, because kidney takes out the impurities with your wee, and it's the liver and the kidneys that get damaged by alcohol. Yeah, but also you can get fat as well, and you can get heart disease. Okay, so don't forget those ones. Illegal drugs. Anybody know? It's quite a wide story, really. So I guess it depends what illegal drugs, but yes. And also, especially if there's needles involved, the risk of blood-borne viruses. Sedentary lifestyle. What's sedentary mean? Yeah, and it's mainly obesity, you're right. But it could be, again, heart disease. And there's a general feeling that cancer can be reduced by exercise, or can be, kept. I don't know about that one, but certainly cardiovascular disease and obesity. Poor diet in general, just not very well balanced diet. Well, how could that affect you? Makes you weak. Yeah, so affect your strength, definitely. Let's see what I got. Oh, it's the same again. Obesity, cancer, cardiovascular disease. But you are right. It would, if you weren't eating very well, you wouldn't have the strength. And vitamins and minerals affect, your skin and your hair and, how you look and that as well. So there's a bit more to it than just that. Your nails and things. Unsafe sex, well, we know that one. Diseases and unwanted pregnancies. And the last one, stress. How can that affect your health? So you could have heart disease, obesity again, because I think people, when they're stressed, sometimes they eat more than they should. You can have high blood pressure. But it can lead to more complicated mental health issues as well. Quite right. And diabetes as well can be brought on by stress, because it starts messing up your blood results. Really, it can just first of all, you eat too much, you have high blood pressure, and all these things together can lead into diabetes. Okay. Okay, everybody, I'm going to say goodbye, and I will see you on Tuesday. Okay, and we'll talk about the evaluation bit of it. Okay, all right.